My name is Haley Baudet, and I'm going to be presenting on rabies virus. So I'm going to start with some general facts about rabies. It's a viral disease, so it's caused by a virus. It's caused by the rabies issiovirus genus in the Rhabdoviridae family. So there are several different strains of rabies virus that cause the same symptoms that you would see in rabies disease. The way it works is it starts in the peripheral nerves and it travels to the central nervous system where it causes those more severe symptoms that you would see later on in the course of the disease. Once the disease is contracted, unfortunately, we don't have a cure. So at this point, it's really important to prevent the disease from occurring in the first place. It's spread through saliva, and usually it would be from one animal to another animal or from an animal to a human. And the current rate right now of death is 60,000 people a year. However, that's probably really underreported. It's probably a lot lower than what it actually is because a lot of those deaths occur in developing countries where sometimes we can't collect as much accurate data as we'd like to. So with the clinical course of rabies, there can be a very long incubation period after the initial introduction of the virus. So the virus can be incubated for 1 to 3 months usually, but this has actually been shown to be as long as several years. And usually patients would report a tingling, itching, or numbness around the bite area. That's a common symptom of rabies. Then at that point, when the patient is becoming um, the infection is becoming more active, they may report flu-like symptoms, so like a fever, a headache, some muscle aches, fatigue, loss of appetite, and nausea. So after the initial symptoms start to develop, the disease starts to progress into late stage. This would be when the virus would um, grow or spread more towards the central nervous system. So you start to see neurological symptoms. You would either see an encephalitic or paralytic type of rabies. So those are two different forms. It's usually one or the other. The encephalitic form is more common, and that's actually the classic presentation that you would see in like popular media or in movies when you see a patient with rabies, or an animal who's foaming at the mouth, acting hyperactive, aggressive. That's the encephalitic form. So with that, you would see the hydrophobia, so fear of water, and with that, it's usually attributed to the fact that patients develop difficulty swallowing, and then in combination with the hyperactivity, they develop this extreme aversion to water. So you'd see hydrophobia, as well as fever, agitation, and combativeness. These patients later would die from respiratory failure and vascular collapse. In the paralytic form, you see an ascending paralysis similar to Guillain-Barré syndrome. This one is less common, again, it's less than 20% of cases, but usually you would see the paralysis starting in the affected limb or bitten area, and then the paralysis would spread, eventually also causing respiratory failure. So in terms of prevalence, as I mentioned earlier, a lot of rabies occurs in developing countries. It's most common in Africa and Southeast Asia, so like India. In these areas, there are a lot of stray dogs in slums, in impoverished communities. Um, these stray dogs get rabies and then bite humans. And 99% of cases of rabies in these countries is due to dog bites. And then also, unfortunately, about half of those cases are in children less than 15 years old. 35% of rabies deaths in the world are in India. And then, just importantly, we're dealing with a disease that mostly is occurring in developing countries where people are facing a lot of poverty. The most common way of treating this disease with these patients is post-exposure prophylaxis. They've already been bitten and they need treatment. The cost in India is $49 per person for post-exposure prophylaxis. In Africa, it's $40 per person. And the issue is that in these populations, the average income is $1 to $2 per day. So the question arises of how these people are going to be able to pay for treatment when they're already bitten. So this is why you see those high numbers of deaths, and probably higher than we know. So when we're talking about prevention, as we mentioned before, there's really no treatment for rabies, so we're going to have to focus on prevention. Prevention really relies on vaccination, the rabies vaccination, and then the post-exposure prophylaxis. So like basically the day that the bite occurs, the day after, as soon as possible. One thing that can be done is that pets can be given a rabies vaccination so that if they're bitten by some other infected animal, they can't spread the disease. Already you can see the issue there with in these developing countries that we're looking at. These animals aren't really pets, they're technically strays. It's harder to basically round them up and give them rabies vaccinations. Further, education is really important about avoiding unfamiliar animals and wild animals, especially for kids, especially animals that are acting strange. Um, and then right here is the post-exposure prophylaxis. So that would include the human rabies immune globulin, Imagam rabies HT, and the rabies vaccine Imavax. So you would give the rabies immune globulin with the rabies vaccine on the first day of exposure, and then you would give the rabies vaccine again on days 3, 7, and 14. So for diagnostic testing for rabies, we can culture, but basically the evidence shows that you need several different testing modalities. So you need samples from the sputum, serum, hopefully the skin if possible, and then cerebrospinal fluid if possible to confirm, because there's often a low sensitivity for if you just have a serum sample or just a sputum sample. So you need several samples to confirm. And then there are many other treatable conditions that affect the central nervous system that are often caused by other viral pathogens that we have to rule out. Um, then you might also see leukocytosis, proteins in the CSF showing up, and then a early stage CT of the brain would not really show many changes, but late stage brain CT for late stage rabies may show cerebral edema. A big indicator for rabies is tingling around the bite area. That's a big red flag for rabies. But rabies should never be ruled out just because the patient isn't sure if they were bitten. For example, if they woke up with a bat in their room and they aren't sure if they were bitten, they should still receive the post-exposure prophylaxis and be tested. So when we consider how we can reduce the incidence of rabies in places like India and Africa, we definitely have to consider the cultural and political factors, also religious beliefs, things like that, that can affect the way we should approach these challenges. A big part of that is, so we're looking at the stray dogs being the real carriers for rabies here. But in these slums, stray dogs are kind of considered pets oftentimes. Um, Citizens will feed them, and they would maybe consider certain ones their pets that would return to their house often to get food. So they're not considered an irritant or a pest by these citizens typically. In 2001, they passed a law in India making killing of stray dogs illegal. So they definitely value these animals. So if we were to suggest removing them in even a humane way from the streets, people may not be so excited about that. Um, Further, regarding education, definitely many of the individuals that we're focusing on here in these slums, they have limited education, especially on like health topics. So oftentimes these people may have cultural beliefs, traditional beliefs in medicine. They can't afford to get health care, so they often would attempt different, family medicine things passed down through generations, so traditional medicine. Um, Further, they may not even understand about germ theory, even, or where rabies even comes from. So that's a big thing that needs to be understood primarily before even um, forming a plan to reduce the incidence of rabies. We need to understand the educational status and needs of the communities. And of course, the most important probably issue is that these people cannot afford treatment oftentimes. The average income is $1 to $2 a day. The post exposure prophylaxis is $40 to $50. So that's a big thing that we need to consider here. So the WHO, the World Health Organization, and the CDC, they're both heavily involved in reducing the incidence of rabies, especially in these countries, African countries and in India. The CDC funds research and makes public announcements about health risks worldwide in order to educate and increase awareness about these issues. And the WHO is an entity of the United Nations that was developed to respond to global health needs. It also works with other organizations in order to advance these outreach efforts for global health. The CDC funds the World Rabies Day, which is an annual awareness day to support the um, development of research and the prevention of rabies. So they really focus on funding research specifically to prevent rabies during World Rabies Day. And the WHO has its own goal of zero human deaths from rabies by 2030. So it has a lot of different initiatives under that goal and is trying to, by any means, get to zero human deaths by 2030. And here are my references. Thank you for listening.